Welcome, this is Health Matters with me, Dishan Kumar, and today we are in Taman Tun, and what we are doing here is we are going to talk about one of the biggest issues in the nation, which is diabetes. Now, we are at Metabolic Healthcare Solutions, and this clinic is specifically designed to actually get patients off their medication, or type 2 diabetes patients off their medication. So join me in today's episode as we talk about how to handle diabetes. Alright, thank you Dr. Manvir for joining us today.
Thank you for having me, Dishan.
Alright, so Metabolic Healthcare Solutions, right?
Yes.
Okay, it's very, you don't really get what, in the sense of what the clinic does. So could you explain that to us? What does your clinic do?
Well, what I deal with primarily is type 2 diabetes and obesity. But most specifically, I center my care of trying to get diabetic patients off their medications. So what I mean by that is try to reverse type 2 diabetes. And I try to get them off their medication, and as well as much as possible lower down for the cases that I can't able to reverse them.
Okay, we have to talk about the why. Why did you actually start this clinic? Maybe you can tell us about that.
Alright, so what I did was I quit the government. That was about a year ago. And to know about the why, we have to go 3 years back. Because I was stationed in Sabah for about 2.5 years, 3 years almost. And when I was there, I was in charge of the NCD clinic, the non-communicable diseases, where mostly I dealt with metabolic diseases, diabetes type 2 and hypertensive patients. So at that point, I was looking after nearly 3,000 patients, around 60 patients a day. And what I noticed was most of the patients in that area, despite the multidiscipline approach that we had a specialist on board, we had a foot clinic, a dietitian, a nutritionist, and we were full on. We even had a fundoscopy machine where we check their eyes annually. So with that standard of care, we were still seeing the numbers of diabetics were going up, the numbers of patients requiring more medications were going up, and not only that, the patients progressing from maxing out their oral doses and going to insulin, being put on insulin, was also increasing massively. It didn't even put a burden on the patient itself, but it was also burdening the government, where we were spending more on medications. What I realized, there was a gap. There was an absolute gap in treatment. Okay, what happens to the patient when he goes home? He sees you for 5 minutes. A patient sees you for 5 minutes, and that's all the time he has. The doctor checks his blood levels, his lab reports, and adjusts his medication, and he says, okay, please lead a healthy lifestyle, exercise, eat right, thank you, come again, I'll see you in another 3 months. The problem is the patient has now to find out information about his diet and how to exercise from the internet, which is there's a plethora of information out there. And the problem arises where they start following different things. And it's no fault of the patient as well, because when they go to the dietitians give them a guideline to follow as well. And sometimes they skew off from the guidelines, and they either go hypo or hyper. They follow that for 2 weeks, and they just go back to eating normally after that. So this is what I realized. The gap was what happens in between the follow-ups. And this is what I started doing when I started experimenting with one of my patients there. And she told me that she wanted to get off her medications. Coincidentally, at that time, I was doing a lot of research about reversing type 2 diabetes. And I think it was by chance that both of us got to work with each other, and we went on. 6 months later, she was medication free until today, and this is now 3 years. She's going on to her 4th year. She has not had any medications at all. And this is why I started doing this, because I saw there was an absolute possibility that reversal is possible. And also there were no guidelines on how to reverse diabetes. No one was doing it. I thought to myself, this is definitely something that we need, all right? Getting patients to get off their medications and treating the disease itself, but not the symptoms, which is the blood sugar levels, the disease, which is the insulin insensitivity. So this is why I started doing it. This is why I opened up this place.
All right, and the type of treatments that you offer, what are the type? Because you say that you are trying to make your patients get off medicine, get off the medication. So the type of treatments that your clinic offers.
Okay, so what I do is I deal with these patients very holistically, and it is also very individualized. What I mean by that is medical nutritional therapy, okay, MNT, which I get the patient to follow a certain regime, and we change their diet, we change their lifestyle, and week on week we monitor them, we try to see how much of medications we can remove. It's very data driven. I see their blood sugar points, and I also do a blood test before and after the program. So within the 5 months, we see how far we can push it. And that's how I do things.
All right, and the whole topic, the whole issue of diabetes in the country, based on your opinion, what do you think, why is it so prevalent in Malaysia?
Okay, well, it is a multifactorial problem, and I think the media, the healthcare, and everyone tends to put the blame on the Malaysians as a whole, that we eat too much and we love food too much. And the first question is, every time we see each other, it's like, hey, sudah makan belum? Have you eaten? You know, we center our culture around food. That is true. But also we have to look at the bigger picture about our food guidelines. What have we been fed all this while? Because our food guidelines have been almost the same. The food pyramid is severely outdated. It came out in the 70s, and we're still using that now. And we have definitely changed the way we've been eating for the past few years. And there is a disconnect, and there's also a huge amount of carbs, foods that have sugars inside, and when we're consuming those are also very highly addictive. Becomes a vicious cycle. And that's what it's not, you know, us as a problem. It's also the food that we're consuming, and unknowingly consuming those foods as making us addicted to them, and this whole lifestyle, it's just a cycle that we are falling into a trap, actually.
All right, and talking about that, like, people know certain foods are bad for them. Malaysian people know. When I go to a mamak shop and I order nasi goreng or Maggi goreng and things like that, it's bad for me, it's oily, the carb content is high. But then you have this attitude where people really don't care. I'm going to eat what I want. And how do you actually handle that? Do you see that in your patients, and has that changed the don't care attitude of Malaysians?
Okay, well, this is a very interesting problem to tackle. Most of my patients, when they come in, of course, they've been eating everything and anything under the sun, and getting them off these foods it's a challenge. But what I do is we change their behaviors and their attitudes towards the food they eat. Because essentially they already have a relationship with the food they've been eating. And when I educate my patients on what this food do to you, all right, internally, all right, what hormones gets released, if you have a high amount of carbs in your body, high amount of insulin gets released, and insulin is a hormone that, you know, brings the sugar into the cell and you be used as energy. But not only that, they understand that insulin is also a fat storage hormone, and the higher of that insulin is being produced that is being produced by your body, because of the high carb content, you are storing fat more than you are burning. Okay, so when I give them this idea, this little a light bulb starts clicking in their head, and it's like, okay, I know what this food does to me. It's very different from saying that, Tishan, you cannot eat this food. This is bad for you. You know it's bad for you, but you don't know why it's bad for you. When my patients get to understand that aha moment, and it's like, okay, if I do this, this is going to raise, that's going to happen to me, this is not going to be burnt, this is going to be stored, do I really want that? And what happens is you create mindfulness. when you create mindfulness, there's no longer the notion of a patient going, anyone going to a food stall or a chap fan or going for nasi padang or whatever, that you're standing in line. It doesn't become autopilot anymore when you pile on things on your plate. You know, there is a sense of responsibility, accountability, and mindfulness. So the patient gets absolutely focused on what they should put into their bodies. So that changes. It's not the don't care attitude, it's probably more of the don't know attitude. Yeah, so that's what I think that could be the possible problem here.
Okay, now the conversation is about healthy lifestyle.
Okay.
So everybody's saying you have to have a healthy lifestyle, you start eating more fruits, juices, smoothies, juice cleanse and all that.
Yeah.
I would just like to know that the healthy lifestyle seems to be focused more on the people who actually can afford it. And we have to talk about that because even me personally, seeing that certain things, if I want to get a smoothie or a juice, it's not cheap. It's quite expensive. So how does the person, the average Malaysian, Ali, Abu, or Raju, or Chong, who earns say 1,500 ringgit a month, what can they do to improve their diet as such?
I see. Okay, there's a big misconception that you have to spend enormous amount of money to eat healthy, and there's so much of health foods that are out there that have been packaged as the new anti-aging, reversal of this and that. There's so many things, and they do cost quite a bit. And detox, the word detox is something that I think is made up so that to sell more drinks or fruit juices or whatever. And these fads are expensive, and they feed into the insecurities of these people, thinking that by doing this you are going to be healthy. And it's not necessarily the case, because anyone with any budget can eat healthy. It's about substituting your food items. It's also about choosing your right options as well, and reading some of the food labels and getting into the know, instead of, you know, let's say in the morning you go to a mamak stall and you're having a roti canai with a dal and a sambal and, you know, having teh tarik on the side. Yes, someone knows it's unhealthy, but for them it's the cheapest option. Okay, well, what you can do instead is have a teh o kosong and have, let's say, 2 half-boiled eggs with some salt and pepper on top. That is substituting, and the cost is almost the same. So the thing is, choices. These are the big things that we should be empowering ourselves with, rather than thinking about it being expensive. So the notion of eating healthy is expensive is actually quite a distorted one. And when people think about being healthy, they should think about more of cooking at home, home prepared meals, taking stuff to work. I know in this day and age, we're so hard on time, we're so pressed on deadlines, and there's hardly enough time. So this is where I also advocate for prepping earlier, so that you plan for your busy days, so that you don't have to eat the junk out there. So that there is a big misconception that, you know, you have to spend a lot of money to be healthy.
All right. And we'll just go on to the final question. Okay. What do you want to achieve with the clinic? I mean, what is your goal or your dream or your vision for the clinic? Okay,
so what I hope is that I get to reach my patients in a faster manner, and also remotely from wherever they are. Right now, I think moving forward, we should actually look into a digital platform where they can access their data points through an app, or, you know, something that they keep on monitoring, and, you know, just try to get, you know, put this into a scalable model. Because I don't think one person in sitting down in the clinic is able to reach a multitude of people, because this problem that we are having is a nationwide problem. If we can work together with the government and with food agencies and dietitians, we can come up to a point where these patients can do it remotely through a platform that can be monitored from a digital platform, if you say, and get that streamlined as well. So that I think I would like to head into that direction in the near future. But for now, for me, is I focus a lot on my patients right now because I get a wealth of information from them. They don't only learn from me, I learn from them as well. Because, you know, adjusting behaviors, going from, you know, getting someone off their medication, it's a very tricky thing to do, and right now is the fine-tuning stage, because no patient is the same. Okay, everyone has their own sets of problems. Even the diet, one diet can work for another, and one won't work for some. So this is where I'm trying to head, is try to reach a bigger population where these changes can be done remotely.